And now we'd like to call Megan Seger forward, the class president, for the class officer's remarks. Megan?
Good evening, and thank you for joining us tonight. For my classmates and fellow nurses, I'm currently experiencing tachycardia, tachypnea, and diaphoresis. For all the non-medical persons in the audience, that translates into my heart is beating out of my chest, I can't catch my breath, and I'm sweating profusely. So if I could just have a second. That being said, I've spent the past 2 years struggling along with the men and women beside me. This has led to my getting to know them, becoming friends with them, and even creating a family-like bond with them. Together, we have made the long transition into becoming nurses. Here are just a few examples of when most of us started realizing we were beginning the transition. We first realized we were becoming nurses when everyone we knew began coming to us with every ache, pain, rash, or symptom they experienced, fully expecting a definitive diagnosis and treatment. Now personally, I can usually take a good guess as to what it may be or how they should treat it, but at times I found myself without a clue. I would then pull out the good old, that does look concerning, maybe you should make an appointment with your doctor. This made me look like I knew what I was talking about, but I wasn't providing false information either. After spending all this time in lecture and clinical, I wanted to prove I'd learned something useful after all this time. We also knew we were becoming nurses when we began washing our hands for a full minute at all times, even at home. After washing for a full minute, we would then dry our hands and retrieve a fresh, dry paper towel to turn off the water per proper nursing technique. This has stuck with us since our very first day of lab, when we spent a total of 2 hours learning to wash our hands. Boy, did things change when we became second-year students and had 15 minutes to learn to master IV starts and all abnormal heart sounds. Finally, we knew we were becoming nurses when someone asked for a pen. Not only could we provide one from our stock in our pockets, but we could present them with the traditional black, blue, or red choices, along with a highlighter, 2 to 3 pencils, and a permanent marker, just to name a few. The 3 examples I mentioned were just to name a few. On behalf of the Butler County Community College Nursing Class of 2012, we want to thank our wonderful nursing instructors, our Dean, Dr. Mahalson, our friends and family, and the array of interesting people at Walmart for allowing us to secretly medically diagnose their acromegaly, Parkinson's disease, congestive heart failure, and renal failure. And then we can assign our NANDA nursing diagnoses as well. Thank you. Now please join me in congratulating the men and women on stage and completing the transition to becoming nurses.